Welcome. It is Friday, May 1st. We are hosting our Friday knee replacement Q&A. So what does that mean? It means that Dr. Sinha, my husband Raj, and I, Diana Braun, are here. We are the ones who wrote Knee Replacement Secrets, and we do our best to go live on most Fridays for you to be able to ask questions you have about knee replacement, whether you're preparing, avoiding, or maybe you're in the middle of it right now. Maybe you are trying to recover and you cannot sleep. You cannot get comfortable. You are swelling. You thought, I had this 2 weeks ago. I thought I'd be like running a marathon by now. What's going wrong? So we're here to answer all of your questions. I had bilateral knee replacement myself 2.5 years ago. So I try to post a video every single day on Instagram and Facebook to help educate you on what you can expect, give you tips and tricks, and that's really why we show up here every week. Marcia, it is your turn here on Facebook. I'm a little over 4 months out and it is still tight in the areas on top or under my knee. I know. I move my leg. If I move my leg, it usually takes care of it. Please help me understand this. Good news. That's normal. But it's really annoying, isn't it, Marcia? It really is annoying. So here's the main reason that I wrote with Raj, my husband, Knee Replacement Secrets. I don't think many of us go into this surgery understanding that it could take up to a year for us to feel 100%. We're like, and you're just like me, Marcia, I'm 4 months out. Why don't I feel great? You're still really early in your recovery. So I love that you recognize if you move a little bit, it loosens up. That's called startup stiffness. We talk about this in the book. You still actually have swelling deep in your knee joint. It's totally, totally normal. So we're going to encourage you, move a little more and make sure that you understand that you've got to keep moving and keep working on bending and gradually building strength every single day. And that is probably for another 4 or even 6 months for you. Just so you know, because most people don't understand that going in.
It takes about a year for the quad to come all the way back to normal,
Yeah.
and a little bit, and 2 years for it to come back to about 130%. The startup pain is because the scar tissue around the artificial joint is still going through a maturation process, and so when you're not moving it, it stiffens up. The first few steps, the first few bends and straightenings cause that scar tissue to stretch out, and then that startup pain goes away. It eventually goes away completely.
Yeah. Is it annoying? Yes, but it's all part of it. All right, everybody, have a great weekend. We're glad you came.
Have a great weekend, everybody.
All right, bye.